Today, we're going to talk all about what we're doing to keep you, our patients, and ourselves as providers safe from coronavirus. Every state has some different mandates in place as to whether or not face masks are required, what can be open, what still has to be closed. And we feel very fortunate that we are still considered an essential provider, which means that the CDC and DHEC do believe that hearing healthcare professionals should in fact be able to safely provide services to their patients because hearing is essential to being able to communicate, especially when we're having to struggle to hear people through masks. One of the topics that has really been a hot topic is masks and the mask effect. A typical surgical mask, such as I'm wearing right now, can reduce someone's voice by approximately 5 to 10 decibels. As we go into some of the thicker masks, like the N95s, or even some of the homemade masks, or even ones that you can order online that are the thicker cotton fabric material, those can reduce somebody's voice by almost 10 decibels. So perceptually, when you have hearing loss, the best case scenario is that you're able to make use of every single possible bit of information, including lip reading, which is obviously impossible when now your face is covered by a mask. Fortunately, all of our offices are supplied with the clear mask, and the clear mask enables patients to still be able to hear my voice while still being able to read my lips. Not everybody has access to these masks, but as part of Carolina Hearing Services and all of our Odd Practice Group affiliated offices, you will be able to see a provider that will be able to utilize the clear mask, or we are also equipped with our face shields. One thing that is absolutely imperative to know, however, is that everything that we are doing to keep our patients safe is also what we expect of our patients to do to keep us safe. We all have families that we want to keep protected from getting ill. And of course, you want us to be staying healthy so that we can be here in our offices to provide you services. Therefore, a mask or a face covering is required at all of our offices. You do need to follow all of the CDC guidelines. No one is allowed to enter the building who has been in contact with anyone who may have been exposed to coronavirus or someone who has had coronavirus and has not yet had a negative test. You need to make sure that you are complying by all face mask requirements. We do have disposable surgical face masks to give to our patients who come in who either forget their face mask or maybe who don't want to wear them. We're not turning any of this coronavirus into a political issue. Face masks are required. Bottom line, they save lives. If you're not willing to wear one, then you will be asked to reschedule your appointment. This again is for our safety as well as for yours and all of the patients who are coming into our office. So aside from masks, what are we doing to make sure that we're keeping our surfaces all around the building safe, as well as being able to help people stay socially distanced? So before and after any patient is seen in our office, there is a ton of disinfecting that is going on all around the building. In the room that I primarily use for all of my testing, my hearing aid programming, before and after every single solitary patient, every surface that they may touch and that I may touch is going to be disinfected with some kind of Clorox wipe or hospital grade disinfectant wipe. That's going to include chairs, tabletops, doorknobs, light switches, even pens, my computer, my keyboard, my otoscope. Every single solitary surface is being disinfected between every single solitary patient. As you're checking out at the front desk where you're seeing our lovely Latanya, if you're purchasing supplies or making any kind of a payment, anything that you may be touching, including our Clover payment credit card machine, every surface, again, every pen, every countertop, and every doorknob is being disinfected before and after every patient is being seen. You may wonder, how is it possible to still see 20 to 30 people in a day? And the reason is that we are staggering our appointments to make sure that we do not have too many people in the office at one time. We can safely seat 2 patients at 6 feet distances in our waiting area. If we do have 2 people in our waiting area at the same time and we get anybody walking in, we will request that you wait in your vehicle until it's safe for you to come in and be able to be distanced from the other people that may be waiting in the office. So while we are still allowing walk-in patients, we are definitely controlling how many people are able to be physically in the office at one time. So please don't be offended if we're asking you to take a seat out in your car until we are able to take care of you. We are also still offering curbside service. So if you just need a clean and check, you can call the office and LaTanya or I will let you know when is a good time for you to come by so that one of us can come out to your vehicle and get your hearing aids to take them back to the office ourselves, clean and check them, and determine if anything is wrong with them or if they just need to be cleaned, and then we will return them to you in your vehicle, thus allowing you to never have to come in the building at all. Same thing, it's always a great idea to give us a call ahead of time so that we can tell if there's going to be a better time throughout the day where you won't be waiting very long in your car. Also, every room, including our entryway, our waiting room, our restrooms, our programming rooms, are all equipped with plenty of hand sanitizer, all of which has no less than 70% isopropyl alcohol so that we can make sure that you are able to clean your hands. I'm able to keep my hands clean, as well as being able to have soap in every restroom, as well as in any other common areas where there may be a sink. We're doing our best to be able to stay open. The last thing we want is to have to be forced to shut down, but it's definitely a two-way street. If we are allowing people to come into our office without masks, the CDC and DHEC could actually force us to close our doors for not being compliant. So while I know that there's a lot of possible leery people from wearing their masks, please know that as a hearing healthcare provider and any healthcare provider, we are here to help you stay healthy and hearing the best you can. So it's really a two-way street, and we want to keep everybody healthy. So again, if you have any questions, you can always feel free to give us a call. If you have any concerns about whether or not there may be multiple people in the office when you are here, just give us a call. But we assure you that we're staggering all of our appointments to make sure that we're limiting the number of people in our office. We are disinfecting all over the place, before, after, even during if necessary. So don't be hesitant to come in to get your hearing evaluated or to get your hearing aids checked. We want to make sure that you can hear the best you can, even with the mask effect. So sometimes we need to make a few adjustments to your hearing aid settings so that if you do work in an area where everyone is wearing masks all day, we can help to give you the settings that you need so that you can still hear your colleagues, your coworkers, and even your customers coming into your offices. I'm Dr. Abby Connell. As always, I appreciate you joining me.